HHA exam. Question 1. Which of the following healthcare settings is for people who will die in approximately 6 months or less? Option A, hospice care. Option B, acute care. Option C, long-term care. Option D, assisted living. The correct answer is option A, hospice care. The correct answer is hospice care. Question 2. What is the term for care given by specialists to help restore or improve function after an illness or injury? Option A, hospice care. Option B, rehabilitation. Option C, respite care. Option D, acute care. The correct answer is option B, rehabilitation. The correct answer is rehabilitation. Question 3. What is another name for 24-hour skilled care that takes place in nursing homes or extended care facilities? Option A, home health care. Option B, hospice care. Option C, outpatient care. Option D, long-term care. The correct answer is option D, long-term care. The correct answer is long-term care. Question 4. For what percentage of home care costs does Medicare pay? Option A, 75%. Option B, 50%. Option C, 25%. Option D, 41%. The correct answer is option D, 41%. The correct answer is 41%. Question 5. What type of care will Medicare pay for? Option A, only care provided in a hospital setting. Option B, only care that is determined to be medically necessary. Option C, all care requested by the family. Option D, any care provided by a home health aide. The correct answer is option B, only care that is determined to be medically necessary. The correct answer is only care that is determined to be medically necessary. Question 6. What does the abbreviation HMO stand for? Option A, Health Maintenance Organization. Option B, Hospital Management Office. Option C, Home Maintenance Organization. Option D, Home Medical Organization. The correct answer is option A, Health Maintenance Organization. The correct answer is Health Maintenance Organization. Question 7. Which of the following factors helps explain the purpose of and need for home health care? Option A, it is only for people who are wealthy. Option B, people who are ill or disabled feel more comfortable at home. Option C, it is more expensive than hospital care. Option D, it allows insurance companies to control treatment. The correct answer is option B, people who are ill or disabled feel more comfortable at home. The correct answer is people who are ill or disabled feel more comfortable at home. Question 8. Which of the following is a key event in the history of home care services? Option A, in 1959, a national conference on homemaker services was held. Option B, in 1980, Medicare stopped paying for home care. Option C, in 1945, the first home health agency was closed. Option D, in 1965, home health care was banned. The correct answer is option A, in 1959, a national conference on homemaker services was held. The correct answer is in 1959, a national conference on homemaker services was held. Question 9. What is required by the Centers for Medicare and Medicaid Services, CMS, regarding home health aide training? Option A, HHAs only need a high school diploma. Option B, HHAs must be licensed practical nurses. Option C, HHAs must have at least 120 hours of training. Option D, HHAs must have completed at least 75 hours of training before they can begin working. The correct answer is option D, HHAs must have completed at least 75 hours of training before they can begin working. The correct answer is HHAs must have completed at least 75 hours of training before they can begin working. Question 10. What may be different about working in a home than working in a facility? Option A, the aide has less independence. Option B, the environment is more structured and controlled. Option C, the aide does not have to document their work. Option D, home health aides have more contact with the client's family. The correct answer is option D, home health aides have more contact with the client's family. The correct answer is home health aides have more contact with the client's family. Question 11. Which member of the care team diagnoses disease and prescribes treatment? Option A, home health aide. Option B, nurse. Option C, physical therapist. Option D, physician, MD. The correct answer is option D, physician, MD. The correct answer is physician, MD. Question 12. Which care team members are licensed professionals who may assign tasks to HHAs? Option A, family members. Option B, nurses, occupational therapists. Option C, medical assistants. Option D, physicians only. The correct answer is option B, nurses, occupational therapists. The correct answer is nurses, occupational therapists. Question 13. What is true of an HHA's responsibilities if an activity is not listed in the care plan? Option A, the HHA should perform it if they have time. Option B, The HHA should perform it if the client asks. Option C. The HHA should perform it if the family asks. Option D. The HHA should not perform the activity if it is not listed on the care plan. The correct answer is option D. The HHA should not perform the activity if it is not listed on the care plan. The correct answer is the HHA should not perform the activity if it is not listed on the care plan. Question 14. Which statement is true regarding the role of clients in the care team? Option A. The client is only involved when a doctor is present. Option B. The client is the least important member of the team. Option C. The care team revolves around the client and his or her condition, treatment, and progress. Option D. The client has no say in their care plan. The correct answer is option C. The care team revolves around the client and his or her condition, treatment, and progress. The correct answer is the care team revolves around the client and his or her condition, treatment, and progress. Question 15. Why is reporting a client's changes and problems to the supervisor an important role of the HHA? Option A. It allows the supervisor to visit the client's home. Option B. It is a requirement for the aide's insurance. Option C. It ensures the aide gets paid on time. Option D. The care plan must be updated as the client's condition changes. The correct answer is option D. The care plan must be updated as the client's condition changes. The correct answer is the care plan must be updated as the client's condition changes. Question 16. Which of the following is a typical task that an HHA performs? Option A. Performing surgery. Option B. Giving skin care. Option C. Diagnosing illness. Option D. Prescribing medication. The correct answer is option B. Giving skin care. The correct answer is giving skin care. Question 17. Which task is outside the scope of practice for an HHA? Option A. Inserting a tube into a client's body. Option B. Assisting with range of motion exercises. Option C. Helping with grooming. Option D. Measuring vital signs. The correct answer is option A. Inserting a tube into a client's body. The correct answer is inserting a tube into a client's body. Question 18. What is one basic federal regulation that applies to HHAs? Option A. HHAs must have a nursing degree. Option B. HHAs must be certified in every state. Option C. HHAs must complete at least 75 hours of training and/or pass a competency evaluation before they begin working. Option D. HHAs must work at least 40 hours a week. The correct answer is option C. HHAs must complete at least 75 hours of training and/or pass a competency evaluation before they begin working. The correct answer is HHAs must complete at least 75 hours of training and/or pass a competency evaluation before they begin working. Question 19. Which of the following is an example of a common policy at a home health agency? Option A. HHAs must follow the client's care plan. Option B. HHAs can accept expensive gifts from clients. Option C. HHAs do not need to document their daily tasks. Option D. HHAs may share their personal problems with clients. The correct answer is option A. HHAs must follow the client's care plan. The correct answer is HHAs must follow the client's care plan. Question 20. What does a professional relationship between an HHA and a client include? Option A. Sharing personal information with the client. Option B. Giving the client a personal cell phone number. Option C. Keeping client information confidential. Option D. Borrowing money from the client. The correct answer is option C. Keeping client information confidential. The correct answer is keeping client information confidential. Question 21. If a client has purchased a special gift for an HHA, what is the best response? Option A. The HHA should refuse the gift but thank the client for thinking of her. Option B. The HHA should accept it but give it back later. Option C. The HHA should complain to the supervisor about the gift. Option D. The HHA should accept it and not tell anyone. The correct answer is option A. The HHA should refuse the gift but thank the client for thinking of her. The correct answer is the HHA should refuse the gift but thank the client for thinking of her. Question 22. Which of the following is an example of an HHA behaving professionally with an employer? Option A. Ignoring the dress code. Option B. Arriving late to work. Option C. Taking personal phone calls during shifts. Option D. Documenting carefully. The correct answer is option D. Documenting carefully. The correct answer is documenting carefully. Question 23. What is the best type of jewelry for an HHA to wear to work? Option A. A waterproof watch. Option B. Multiple rings on every finger. Option C. A heavy necklace. Option D. Large hoop earrings. The correct answer is option A. A waterproof watch. The correct answer is a waterproof watch. Question 24. What is the definition of empathy? Option A, being able to identify with the feelings of others. Option B, agreeing with everything a person says. Option C, feeling sorry for someone else. Option D, ignoring the emotions of others. The correct answer is option A, being able to identify with the feelings of others. The correct answer is being able to identify with the feelings of others. Question 25. What is a responsibility of a home health agency as an employer? Option A, employers must pay for the aide's personal vehicle. Option B, employers must allow aides to set their own hours. Option C, employers must provide initial training and continuing in-service training. Option D, employers must provide free housing for aides. The correct answer is option C, employers must provide initial training and continuing in-service training. The correct answer is employers must provide initial training and continuing in-service training. Question 26. Who is the most important member of the care team? Option A, the HHA supervisor. Option B, the client. Option C, the nurse. Option D, the physician. The correct answer is option B, the client. The correct answer is the client. Question 27. What is the definition of the chain of command? Option A, the policy for client billing. Option B, the schedule of all the workers. Option C, the list of tasks for the day. Option D, the line of authority in an agency. The correct answer is option D, the line of authority in an agency. The correct answer is the line of authority in an agency. Question 28. What is the term for the knowledge of right and wrong? Option A, policies. Option B, procedures. Option C, laws. Option D, ethics. The correct answer is option D, ethics. The correct answer is ethics. Question 29. Which of the following is an example of ethical behavior by an HHA? Option A, protecting a client's privacy. Option B, falsifying a documentation record. Option C, sharing a client's secret with a friend. Option D, accepting a cash tip from a client. The correct answer is option A, protecting a client's privacy. The correct answer is protecting a client's privacy. Question 30. Which term means purposefully causing physical, mental, or emotional pain or injury to someone? Option A, ethics. Option B, neglect. Option C, malpractice. Option D, abuse. The correct answer is option D, abuse. The correct answer is abuse. Question 31. What is required of an HHA if they suspect that a client is being abused? Option A, the HHA should keep it a secret to protect the client's privacy. Option B, the HHA should wait and see if it happens again. Option C, the HHA should confront the abuser. Option D, the HHA should report immediately to his supervisor. The correct answer is option D, the HHA should report immediately to his supervisor. The correct answer is the HHA should report immediately to his supervisor. Question 32. Which term means the improper or illegal use of a person's money, possessions, property, or other assets? Option A, financial abuse. Option B, psychological abuse. Option C, physical abuse. Option D, sexual abuse. The correct answer is option A, financial abuse. The correct answer is financial abuse. Question 33. Which of the following is an example of sexual abuse? Option A, forcing a client to eat. Option B, isolating a client from others. Option C, stealing a client's jewelry. Option D, rubbing up against a client inappropriately. The correct answer is option D, rubbing up against a client inappropriately. The correct answer is rubbing up against a client inappropriately. Question 34. Which of the following is an example of physical abuse? Option A, teasing a client. Option B, shoving a client. Option C, yelling at a client. Option D, ignoring a client's call light. The correct answer is option B, shoving a client. The correct answer is shoving a client. Question 35. Threatening to harm a client if they tell another caregiver about a problem is an example of what type of abuse? Option A, physical abuse. Option B, sexual abuse. Option C, financial abuse. Option D, psychological abuse. The correct answer is option D, psychological abuse. The correct answer is psychological abuse. Question 36. For an HHA, what does confidentiality mean? Option A, sharing information only with the client's family. Option B, posting client photos on social media. Option C, keeping client information private. Option D, telling other aides about the client's history. The correct answer is option C, keeping client information private. The correct answer is keeping client information private. Question 37. With whom may an HHA share a client's medical information? Option A, with other members of the care team. Option B, with anyone who asks. Option C, with the HHA's family and friends. Option D, with the client's neighbors. The correct answer is option A, with other members of the care team. The correct answer is with other members of the care team. Question 38. Which of the following is a term for a legal document that designates what kind of care a person wants if he is unable to make that decision himself? Option A, service agreement. Option B, advance directive. Option C, care plan. Option D, incident report. The correct answer is option B, advance directive. The correct answer is advance directive. Question 39. Which of the following is an example of an advance directive? Option A, a driver's license. Option B, durable power of attorney for health care. Option C, a birth certificate. Option D, a medical dictionary. The correct answer is option B, durable power of attorney for health care. The correct answer is durable power of attorney for health care. Question 40. What is the best way for an HHA to keep clients' health information confidential? Option A, store, file, or shred documents according to agency policy. Option B, carry all client files in the car's front seat. Option C, keep documents on the kitchen counter for easy access. Option D, give the files to the client's daughter for safekeeping. The correct answer is option A, store, file, or shred documents according to agency policy. The correct answer is store, file, or shred documents according to agency policy. Question 41. Which of the following behaviors promotes clients' rights? Option A, encouraging a client to participate in care planning. Option B, making all decisions for the client. Option C, restricting the client's visitors. Option D, ignoring the client's preferences. The correct answer is option A, encouraging a client to participate in care planning. The correct answer is encouraging a client to participate in care planning. Question 42. What is the correct order of the three-step communication process? Option A, sender sends message, feedback is given, receiver receives message. Option B, sender sends message, receiver receives message, receiver provides feedback. Option C, receiver sends message, sender receives message, sender provides feedback. Option D, feedback is given, sender sends message, receiver receives message. The correct answer is option B, sender sends message, receiver receives message, receiver provides feedback. The correct answer is sender sends message, receiver receives message, receiver provides feedback. Question 43. Which of the following is an example of nonverbal communication? Option A, pointing to a cookie. Option B, speaking loudly. Option C, singing a song. Option D, writing a note. The correct answer is option A, pointing to a cookie. The correct answer is pointing to a cookie. Question 44. Which of the following is an example of a barrier to communication? Option A, HHA uses medical terminology with the client. Option B, HHA speaks clearly. Option C, HHA listens actively. Option D, HHA uses simple words. The correct answer is option A, HHA uses medical terminology with the client. The correct answer is HHA uses medical terminology with the client. Question 45. Which of the following are ways for HHAs to avoid barriers to communication? Option A, the HHA should talk about their own problems. Option B, the HHA should ask open-ended questions that require more than yes or no responses. Option C, the HHA should use slang and idioms. Option D, the HHA should finish the client's sentences. The correct answer is option B, the HHA should ask open-ended questions that require more than yes or no responses. The correct answer is the HHA should ask open-ended questions that require more than yes or no responses. Question 46. Which of the following is an example of active listening? Option A, HHA interrupting the client to share a story. Option B, HHA checking their phone during the conversation. Option C, HHA looking out the window while the client speaks. Option D, HHA focusing on the client and providing feedback. The correct answer is option D, HHA focusing on the client and providing feedback. The correct answer is HHA focusing on the client and providing feedback. Question 47. Which of the following sentences is an example of a fact? Option A, Mr. Craig seems to be in a bad mood. Option B, Mr. Craig needed help to get to the bathroom today. Option C, Mr. Craig is probably lonely. Option D, Mr. Craig is feeling very lazy today. The correct answer is option B, Mr. Craig needed help to get to the bathroom today. The correct answer is Mr. Craig needed help to get to the bathroom today. Question 48. If a client makes a request that an HHA cannot honor, what would be the best response? Option A, the HHA should do it anyway to make the client happy. Option B, the HHA should explain why the request cannot be fulfilled and report to her supervisor. Option C, the HHA should ignore the request and walk away. Option D, the HHA should tell the client the request is stupid. The correct answer is option B, The HHA should explain why the request cannot be fulfilled and report to her supervisor. The correct answer is the HHA should explain why the request cannot be fulfilled and report to her supervisor. Question 49. What is the part of the word that is added to the end of a root to form a new word? Option A, abbreviation. Option B, prefix. Option C, combining form. Option D, suffix. The correct answer is option D, suffix. The correct answer is suffix. Question 50. Which of the following should an HHA report about a client to her supervisor immediately? Option A, chest pain, high fever. Option B, a preference for a different juice. Option C, a change in the TV channel. Option D, a request for a clean towel. The correct answer is option A, chest pain, high fever. The correct answer is chest pain, high fever. Question 51. Which of the following is an example of objective information? Option A, Mrs. Johnson is acting very grumpy today. Option B, Mrs. Johnson is probably tired of staying in bed. Option C, Mrs. Johnson seems to have a headache. Option D, there are raised, red marks the size of pinpricks on Mrs. Johnson's torso. The correct answer is option D, there are raised, red marks the size of pinpricks on Mrs. Johnson's torso. The correct answer is there are raised, red marks the size of pinpricks on Mrs. Johnson's torso. Question 52. Which of the following senses is not used in making observations? Option A, hearing. Option B, taste. Option C, smell. Option D, sight. The correct answer is option B, taste. The correct answer is taste. Question 53. Why is accurate documentation important? Option A, it is required so the aide can get a promotion. Option B, it is only necessary if the client is difficult. Option C, it is used to judge the aide's personality. Option D, documentation provides an up-to-date record of resident's status and care. The correct answer is option D, documentation provides an up-to-date record of resident's status and care. The correct answer is documentation provides an up-to-date record of resident's status and care. Question 54. When should documentation be recorded? Option A, immediately after care is given. Option B, before the care is performed. Option C, at the end of the work week. Option D, when the aide has free time at home. The correct answer is option A, immediately after care is given. The correct answer is immediately after care is given. Question 55. Which of the following occurrences is considered an incident and requires a report to be completed? Option A, the client takes a nap. Option B, the client eats all their lunch. Option C, the client watches a movie. Option D, the client falls. The correct answer is option D, the client falls. The correct answer is the client falls. Question 56. When making a call, what should the HHA do? Option A, identify herself and state why she is calling. Option B, start the conversation by talking about the weather. Option C, complain about her heavy workload. Option D, wait for the other person to guess who she is. The correct answer is option A, identify herself and state why she is calling. The correct answer is identify herself and state why she is calling. Question 57. Which of the following is a positive response to cultural diversity? Option A, judging others based on their background. Option B, expecting everyone to behave the same way. Option C, ignoring a client's religious traditions. Option D, valuing and respecting each person as an individual. The correct answer is option D, valuing and respecting each person as an individual. The correct answer is valuing and respecting each person as an individual. Question 58. What is 9 p.m. in military time? Option A, 1,200 hours. Option B, 1,900 hours. Option C, 2,100 hours. Option D, 0900 hours. The correct answer is option C, 2,100 hours. The correct answer is 2,100 hours. Question 59. When a client becomes combative, what should the HHA do? Option A, leave the home immediately without telling anyone. Option B, yell back at the client to show authority. Option C, try to find out what triggered the behavior. Option D, hit the client back in self-defense. The correct answer is option C, try to find out what triggered the behavior. The correct answer is try to find out what triggered the behavior. Question 60. If a client makes an inappropriate request of an HHA, what should the HHA do? Option A, tell the client's family about the request to embarrass him. Option B, laugh and go along with it. Option C, pretend she didn't hear the request. Option D, politely let the client know that it is not allowed. The correct answer is option D, politely let the client know that it is not allowed. The correct answer is politely let the client know that it is not allowed. Question 61. What religion is divided into Reform, Conservative, and Orthodox movements and has religious leaders called rabbis? Option A, Buddhism. Option B, Islam. Option C, Judaism. Option D, Christianity. The correct answer is option C, Judaism. The correct answer is Judaism. Question 62. What religious group believes that life is filled with suffering caused by desire and emphasizes meditation? Option A, Buddhists. Option B, Hindus. Option C, atheists. Option D, Christians. The correct answer is option A, Buddhists. The correct answer is Buddhists. Question 63. Which of the following religions has many subgroups and followers who believe that Jesus Christ is the Son of God? Option A, Christianity. Option B, Judaism. Option C, Buddhism. Option D, Islam. The correct answer is option A, Christianity. The correct answer is Christianity. Question 64. Which of the following people actively deny the existence of God? Option A, atheists. Option B, Buddhists. Option C, Christians. Option D, agnostics. The correct answer is option A, atheists. The correct answer is atheists. Question 65. What is 0530 hours in regular time? Option A, 5:30 a.m. Option B, 5:30 p.m. Option C, 5:03 a.m. Option D, 3:50 a.m. The correct answer is option A, 5:30 a.m. The correct answer is 5:30 a.m. Question 66. Which of the following shows the correct conversion of 2:35 p.m. to military time? Option A, 1,435 hours. Option B, 1,235 hours. Option C, 2,235 hours. Option D, 0235 hours. The correct answer is option A, 1,435 hours. The correct answer is 1,435 hours. Question 67. What is infection prevention? Option A, a set of methods used to prevent the spread of disease. Option B, a way to make the home look clean. Option C, the process of getting vaccinated. Option D, the treatment of diseases once they occur. The correct answer is option A, a set of methods used to prevent the spread of disease. The correct answer is a set of methods used to prevent the spread of disease. Question 68. What happens if one of the links in the chain of infection is broken? Option A, the chain becomes stronger. Option B, the infection spreads faster. Option C, the infection stays the same. Option D, the infection is stopped. The correct answer is option D, the infection is stopped. The correct answer is the infection is stopped. Question 69. When will a home health aide, HHA, come into contact with microorganisms? Option A, only when touching blood. Option B, every time the HHA touches something. Option C, only when cleaning the bathroom. Option D, only when the client is sick. The correct answer is option B, every time the HHA touches something. The correct answer is every time the HHA touches something. Question 70. Which of the following is considered a mucous membrane? Option A, lining of the mouth. Option B, the skin on the hands. Option C, the hair on the head. Option D, the soles of the feet. The correct answer is option A, lining of the mouth. The correct answer is lining of the mouth. Question 71. Transmission of pathogens can occur through direct contact, which results from what? Option A, touching the infected person or his secretions. Option B, touching an object used by an infected person. Option C, eating food prepared by an infected person. Option D, breathing the same air as an infected person. The correct answer is option A, touching the infected person or his secretions. The correct answer is touching the infected person or his secretions. Question 72. Under standard precautions, what do body fluids include? Option A, tears. Option B, hair. Option C, urine. Option D, sweat. The correct answer is option C, urine. The correct answer is urine. Question 73. What does standard precautions mean? Option A, treating all blood, body fluids, and mucous membranes as if they were infected. Option B, washing hands only after the shift is over. Option C, wearing gloves at all times in the client's home. Option D, only being careful around clients who look sick. The correct answer is option A, treating all blood, body fluids, and mucous membranes as if they were infected. The correct answer is treating all blood, body fluids, and mucous membranes as if they were infected. Question 74. With whom should an HHA use standard precautions? Option A, only with clients who have HIV. Option B, with every client in his care. Option C, only with clients who have TB. Option D, only with clients who are bleeding. The correct answer is option B, with every client in his care. The correct answer is with every client in his care. Question 75. What is the single most important thing an HHA can do to prevent the spread of disease? Option A, wear 2 pairs of gloves. Option B, wear a mask at all times. Option C, wash your hands. Option D, use hand sanitizer instead of soap. The correct answer is option C, wash your hands. The correct answer is wash your hands. Question 76. What is hand hygiene? Option A, washing hands with either plain or antiseptic soap and water or using alcohol-based hand rubs. Option B, only washing hands with hot water. Option C, only using hand sanitizer. Option D, wearing gloves to keep hands clean. The correct answer is option A, washing hands with either plain or antiseptic soap and water or using alcohol-based hand rubs. The correct answer is washing hands with either plain or antiseptic soap and water or using alcohol-based hand rubs. Question 77. When washing hands, for how long should an HHA use friction? Option A, at least 10 seconds. Option B, at least 20 seconds. Option C, at least 60 seconds. Option D, at least 5 seconds. The correct answer is option B, at least 20 seconds. The correct answer is at least 20 seconds. Question 78. Which of the following is true of wearing gloves? Option A, gloves should be changed before contact with mucous membranes. Option B, gloves do not need to be changed between tasks on the same client. Option C, gloves should be worn while driving to the client's home. Option D, gloves can be washed and reused. The correct answer is option A, gloves should be changed before contact with mucous membranes. The correct answer is gloves should be changed before contact with mucous membranes. Question 79. What is the proper order to don personal protective equipment, PPE? Option A, put on mask, gown, gloves, and goggles. Option B, put on gown, mask, goggles, and gloves. Option C, put on goggles, gloves, gown, and mask. Option D, put on gloves, goggles, mask, and gown. The correct answer is option B, put on gown, mask, goggles, and gloves. The correct answer is put on gown, mask, goggles, and gloves. Question 80. Which of the following is true of transmission-based precautions? Option A, they are only used in hospitals. Option B, they are practiced in addition to standard precautions. Option C, they replace standard precautions. Option D, they are only used for foodborne illnesses. The correct answer is option B, they are practiced in addition to standard precautions. The correct answer is they are practiced in addition to standard precautions. Question 81. When cleaning a body fluid spill, what is the first step an HHA should take? Option A, wipe it up with a paper towel. Option B, spray it with disinfectant. Option C, call the supervisor. Option D, put on gloves. The correct answer is option D, put on gloves. The correct answer is put on gloves. Question 82. What is one example of an airborne disease? Option A, hepatitis B. Option B, HIV, AIDS. Option C, MRSA. Option D, tuberculosis. The correct answer is option D, tuberculosis. The correct answer is tuberculosis. Question 83. In order for an object to be called clean in a healthcare setting, it must be what? Option A, shiny and white. Option B, washed with cold water. Option C, free of all microorganisms. Option D, free of pathogens. The correct answer is option D, free of pathogens. The correct answer is free of pathogens. Question 84. Which statement is true of sterilization? Option A, sterilization means most pathogens are removed. Option B, sterilization is the same as cleaning. Option C, sterilization means that all microorganisms are destroyed. Option D, sterilization is only used for clothing. The correct answer is option C, sterilization means that all microorganisms are destroyed. The correct answer is sterilization means that all microorganisms are destroyed. Question 85. What is one way that blood-borne pathogens can be transmitted? Option A, by touching a doorknob. Option B, by contact with blood or body fluids. Option C, by hugging an infected person. Option D, by sharing a room with an infected person. The correct answer is option B, by contact with blood or body fluids. The correct answer is by contact with blood or body fluids. Question 86. What statement is true of hepatitis B, HBV? Option A, HBV only affects the skin. Option B, the vaccine for HBV helps prevent the disease. Option C, HBV is spread through the air. Option D, there is no way to prevent HBV. The correct answer is option B, the vaccine for HBV helps prevent the disease. The correct answer is the vaccine for HBV helps prevent the disease. Question 87. What is true of a person with TB disease? Option A, they do not need medical treatment. Option B, they always show symptoms immediately. Option C, they can spread it to others. Option D, they cannot infect anyone else. The correct answer is option C, they can spread it to others. The correct answer is they can spread it to others. Question 88. How is HIV spread? Option A, by blood. Option B, by toilet seats. Option C, by shaking hands. Option D, by coughing. The correct answer is option A, by blood. The correct answer is by blood. Question 89. Which of the following is true of HIV testing? Option A, the results are confidential and cannot be shared with anyone. Option B, results are published in the agency newsletter. Option C, anyone can access the test results online. Option D, testing is mandatory for all healthcare workers. The correct answer is option A, the results are confidential and cannot be shared with anyone. The correct answer is the results are confidential and cannot be shared with anyone. Question 90. In which of the following people is tuberculosis most likely to develop? Option A, people who have HIV. Option B, people who exercise regularly. Option C, people who live in rural areas. Option D, people who eat a balanced diet. The correct answer is option A, people who have HIV. The correct answer is people who have HIV. Question 91. How is MRSA most often spread? Option A, by insect bites. Option B, by direct physical contact. Option C, by breathing in infected droplets. Option D, by eating contaminated food. The correct answer is option B, by direct physical contact. The correct answer is by direct physical contact. Question 92. What is the best way to control the spread of MRSA? Option A, through proper hand washing. Option B, by staying indoors. Option C, by taking antibiotics every day. Option D, by wearing a gown at all times. The correct answer is option A, through proper hand washing. The correct answer is through proper hand washing. Question 93. What is the best way to control the spread of C. diff? Option A, by taking more antibiotics. Option B, through proper hand washing and handling of contaminated waste. Option C, by using alcohol-based hand rubs alone. Option D, by increasing the temperature of the room. The correct answer is option B, through proper hand washing and handling of contaminated waste. The correct answer is through proper hand washing and handling of contaminated waste. Question 94. What is an HHA's responsibility regarding infection prevention? Option A, avoiding any contact with sick clients. Option B, deciding which clients are contagious. Option C, prescribing antibiotics for the client. Option D, following standard precautions in caring for all clients. The correct answer is option D, following standard precautions in caring for all clients. The correct answer is following standard precautions in caring for all clients. Question 95. What is true about body mechanics? Option A, body mechanics require lifting with the back. Option B, body mechanics are only for athletes. Option C, body mechanics are not used in home care. Option D, body mechanics help save energy and prevent injury. The correct answer is option D, body mechanics help save energy and prevent injury. The correct answer is body mechanics help save energy and prevent injury. Question 96. When helping a client sit up, stand up, or walk, what should the HHA do? Option A, lock their elbows. Option B, keep their legs straight. Option C, bend their knees. Option D, lift with their back muscles. The correct answer is option C, bend their knees. The correct answer is bend their knees. Question 97. Which of the following is a way to use proper body mechanics? Option A, the HHA should twist at the waist when lifting. Option B, the HHA should hold her breath while lifting. Option C, the HHA should stand with her legs shoulder width apart. Option D, the HHA should keep the object far away from her body. The correct answer is option C, the HHA should stand with her legs shoulder width apart. The correct answer is the HHA should stand with her legs shoulder width apart. Question 98. Which of the following statements is true of preventing falls? Option A, leave area rugs on the floor. Option B, clear walkways of clutter. Option C, tell the client to walk faster. Option D, keep the lights turned low. The correct answer is option B, clear walkways of clutter. The correct answer is clear walkways of clutter. Question 99. When serving hot drinks to clients, what should the HHA do? Option A, hand the cup to the client without a lid. Option B, fill the cup to the very brim. Option C, put the hot drink on the edge of the table. Option D, pour hot drinks away from clients. The correct answer is option D, pour hot drinks away from clients. The correct answer is pour hot drinks away from clients. Question 100. Which of the following statements is true of choking? Option A, people who are weak and unconscious are at a higher risk for choking. Option B, choking only happens to children. Option C, you should never help someone who is choking. Option D. A person who is choking can always speak. The correct answer is option A. People who are weak and unconscious are at a higher risk for choking. The correct answer is people who are weak and unconscious are at a higher risk for choking. Question 101. In which position should a client be placed while eating? Option A. Leaning to the side. Option B. In a reclined position. Option C. Sitting as upright as possible. Option D. Lying flat on their back. The correct answer is option C. Sitting as upright as possible. The correct answer is sitting as upright as possible. Question 102. RACE is an acronym for a safety rule and means what? Option A. Remove all fuel, apply water, close doors, escape. Option B. Run from fire, alert everyone, call emergency, exit. Option C. Review safety, announce fire, clear area, evacuate. Option D. Rescue anyone in danger, activate alarm, contain fire, extinguish. The correct answer is option D. Rescue anyone in danger, activate alarm, contain fire, extinguish. The correct answer is rescue anyone in danger, activate alarm, contain fire, extinguish. Question 103. Which of the following poses a fire hazard? Option A. A fire extinguisher in the kitchen. Option B. Unplugging an iron after use. Option C. Paint thinner stored next to a hot water heater. Option D. A smoke alarm with new batteries. The correct answer is option C. Paint thinner stored next to a hot water heater. The correct answer is paint thinner stored next to a hot water heater. Question 104. How often should smoke alarms be checked to ensure they are in working condition? Option A. Every week. Option B. Monthly. Option C. Every 2 years. Option D. Once a year. The correct answer is option B. Monthly. The correct answer is monthly. Question 105. If the HHA must leave something in his car when using the car for work, where is the best place to leave it? Option A. In the trunk. Option B. On the dashboard. Option C. In the cup holder. Option D. On the front seat. The correct answer is option A. In the trunk. The correct answer is in the trunk. Question 106. How can an HHA reduce the risk of an automobile accident when driving to a client's home? Option A. By texting while driving. Option B. By eating a meal while driving. Option C. By speeding to arrive on time. Option D. By planning their route in advance. The correct answer is option D. By planning their route in advance. The correct answer is by planning their route in advance. Question 107. Where would be the best place to store a car insurance card? Option A. In the owner's wallet or purse. Option B. In the trunk. Option C. Under the floor mat. Option D. Taped to the window. The correct answer is option A. In the owner's wallet or purse. The correct answer is in the owner's wallet or purse. Question 108. What should the HHA do if he reaches a client's home and finds nobody is there? Option A. Break into the home to check for the client. Option B. Leave and go to the next client's home without reporting. Option C. Wait on the porch until someone comes home. Option D. Call his supervisor and not enter the home. The correct answer is option D. Call his supervisor and not enter the home. The correct answer is call his supervisor and not enter the home. Question 109. Which of the following is a tip to avoid trouble when working in a high-crime area? Option A. The HHA should be sure someone knows her schedule and should call the office at the end of the workday. Option B. The HHA should carry a large amount of cash. Option C. The HHA should walk in dark alleys. Option D. The HHA should wear expensive jewelry. The correct answer is option A. The HHA should be sure someone knows her schedule and should call the office at the end of the workday. The correct answer is the HHA should be sure someone knows her schedule and should call the office at the end of the workday. Question 110. Which of the following is information an HHA should be prepared to give when calling emergency services? Option A. The name of the client's favorite TV show. Option B. The phone number and address where the emergency is happening. Option C. The aide's favorite food. Option D. The client's insurance policy number. The correct answer is option B. The phone number and address where the emergency is happening. The correct answer is the phone number and address where the emergency is happening. Question 111. What are the first steps to take when approaching an emergency? Option A. Perform CPR even if not needed. Option B. Move the victim as far as possible. Option C. Assess the situation and the victim. Option D. Call the supervisor immediately without looking. The correct answer is option C. Assess the situation and the victim. The correct answer is assess the situation and the victim. Question 112. In which of the following situations should an HHA give abdominal thrusts to a client? Option A. The client cannot speak or cough. Option B. The client is sleeping. Option C. The client has a minor scrape. Option D. The client is coughing forcefully. The correct answer is option A. The client cannot speak or cough. The correct answer is the client cannot speak or cough. Question 113. If a client is in shock, what should an HHA do? Option A. Make the client stand up and walk. Option B. Elevate the client's feet unless a head or abdominal injury exists. Option C. Give the client a large meal. Option D. Place the client in a sitting position. The correct answer is option B. Elevate the client's feet unless a head or abdominal injury exists. The correct answer is elevate the client's feet unless a head or abdominal injury exists. Question 114. When a client is suspected of having a heart attack, what should an HHA do? Option A. Loosen clothing around the neck. Option B. Encourage the client to exercise. Option C. Leave the client alone to rest. Option D. Give the client a glass of cold water. The correct answer is option A. Loosen clothing around the neck. The correct answer is loosen clothing around the neck. Question 115. To control bleeding, what should an HHA do? Option A. Hold a towel against the wound and press down hard. Option B. Apply a loose bandage. Option C. Wait for the bleeding to stop on its own. Option D. Rinse the wound with hot water. The correct answer is option A. Hold a towel against the wound and press down hard. The correct answer is hold a towel against the wound and press down hard. Question 116. What should an HHA do if they suspect poisoning? Option A. Wait until the client starts feeling sick. Option B. The HHA should don gloves and look for a container that will help determine what the client took or ate. Option C. Give the client milk immediately. Option D. Make the client vomit. The correct answer is option B. The HHA should don gloves and look for a container that will help determine what the client took or ate. The correct answer is the HHA should don gloves and look for a container that will help determine what the client took or ate. Question 117. To treat a minor burn, an HHA should use what to decrease the temperature of the skin? Option A. Ice cubes. Option B. Hot water. Option C. Cool water. Option D. Butter. The correct answer is option C. Cool water. The correct answer is cool water. Question 118. Which of the following is a correct response if a client is having a seizure? Option A. Give the client a drink of water. Option B. Move furniture away to prevent injury to the client. Option C. Place a wooden spoon in the client's mouth. Option D. Hold the client down to stop the movements. The correct answer is option B. Move furniture away to prevent injury to the client. The correct answer is move furniture away to prevent injury to the client. Question 119. If a client faints, what should an HHA do? Option A. Leave him where he is. Option B. Lower him to the floor. Option C. Prop him up in a chair. Option D. Pour water on his face. The correct answer is option B. Lower him to the floor. The correct answer is lower him to the floor. Question 120. When responding to shock, it is important to do what? Option A. Make the client walk around. Option B. Give the client something to drink. Option C. Maintain normal body temperature. Option D. Keep the client's head elevated. The correct answer is option C. Maintain normal body temperature. The correct answer is maintain normal body temperature. Question 121. What is an example of a physical need? Option A. The need for self-esteem. Option B. The need for acceptance. Option C. The need for love. Option D. The need for water. The correct answer is option D. The need for water. The correct answer is the need for water. Question 122. What is an example of a psychosocial need? Option A. The need for oxygen. Option B. The need for acceptance. Option C. The need for sleep. Option D. The need for food. The correct answer is option B. The need for acceptance. The correct answer is the need for acceptance. Question 123. If an HHA encounters a consenting adult client in a sexual situation, she should do what? Option A. Yell at the client for being inappropriate. Option B. Call the family and tell them. Option C. Stay and watch to ensure safety. Option D. Provide privacy and leave the room. The correct answer is option D. Provide privacy and leave the room. The correct answer is provide privacy and leave the room. Question 124. Which of the following statements is true of spiritual needs? Option A. The HHA should teach the client about her own religion. Option B. Clients will have different spiritual needs and beliefs. Option C. All clients should have the same beliefs. Option D. Spiritual needs are not important in healthcare. The correct answer is option B. Clients will have different spiritual needs and beliefs. The correct answer is clients will have different spiritual needs and beliefs. Question 125. A client begins to tell her HHA about Catholicism and the last religious service she attended. Her HHA does not believe in God. What is the best response by the HHA? Option A. Tell the client that God does not exist. Option B. Change the subject immediately. Option C. Listen quietly to the client. Option D. Tell the client she is wrong. The correct answer is option C. Listen quietly to the client. The correct answer is listen quietly to the client. Question 126. How do families help clients? Option A. Communicating with the care team. Option B. Restricting the client's freedom. Option C. Doing the HHA's job for them. Option D. Deciding everything without the client. The correct answer is option A. Communicating with the care team. The correct answer is communicating with the care team. Question 127. If an HHA feels as if he cannot help a client with a problem, what would be the best response? Option A. That's not my problem. Option B. Let me ask my supervisor to call you. Option C. I can't do anything about that. Option D. You should just forget about it. The correct answer is option B. Let me ask my supervisor to call you. The correct answer is let me ask my supervisor to call you. Question 128. Which of the following remarks is a cliché? Option A. How can I help you? Option B. I will report this to the nurse. Option C. I am sorry you are feeling this way. Option D. It will be over before you know it. The correct answer is option D. It will be over before you know it. The correct answer is it will be over before you know it. Question 129. A female client who identifies as gay has physical, emotional, and/or romantic attraction to whom? Option A. Both men and women. Option B. Men. Option C. Neither men nor women. Option D. Women. The correct answer is option D. Women. The correct answer is women. Question 130. What is homeostasis? Option A. A type of physical exercise. Option B. When the body is resting. Option C. The condition in which all of the body systems are working their best. Option D. A state of constant disease. The correct answer is option C. The condition in which all of the body systems are working their best. The correct answer is the condition in which all of the body systems are working their best. Question 131. Which of the following statements is true of the skin? Option A. It does not help regulate body temperature. Option B. It feels heat, cold, pain, touch, and pressure. Option C. It has only one layer. Option D. It is not an organ. The correct answer is option B. It feels heat, cold, pain, touch, and pressure. The correct answer is it feels heat, cold, pain, touch, and pressure. Question 132. How does the skin appear when it is classified as a stage 1 pressure injury? Option A. Skin turns black. Option B. Skin is open and bleeding. Option C. Skin turns red. Option D. Skin looks yellow and dry. The correct answer is option C. Skin turns red. The correct answer is skin turns red. Question 133. Which of the following is a condition that increases the risk of pressure injuries? Option A. Restricted mobility. Option B. Drinking plenty of water. Option C. Eating a balanced diet. Option D. Being active. The correct answer is option A. Restricted mobility. The correct answer is restricted mobility. Question 134. Which of the following statements is true of pressure injuries? Option A. Pressure injuries are always minor. Option B. Pressure injuries can lead to life-threatening infections. Option C. Pressure injuries heal within a few hours. Option D. Pressure injuries only happen to the elderly. The correct answer is option B. Pressure injuries can lead to life-threatening infections. The correct answer is pressure injuries can lead to life-threatening infections. Question 135. What symptom is important to observe and report as a possible sign that a pressure ulcer may be forming? Option A. The client being very happy. Option B. The skin feeling cold. Option C. Complaints of tingling or burning in the area. Option D. The client feeling hungry. The correct answer is option C. Complaints of tingling or burning in the area. The correct answer is complaints of tingling or burning in the area. Question 136. What are areas of the body where the bone lies close to the skin called? Option A. Muscles. Option B. Bony prominences. Option C. Nerves. Option D. Fatty tissues. The correct answer is option B. Bony prominences. The correct answer is bony prominences. Question 137. Which area is at a higher risk of skin breakdown? Option A. Tailbone, sacrum. Option B. The shins. Option C. The tip of the nose. Option D. The palms of the hands. The correct answer is option A. Tailbone, sacrum. The correct answer is tailbone, sacrum. Question 138. What is true of muscles? Option A. They provide movement of body parts. Option B. Muscles are not connected to bones. Option C. There are only 50 muscles in the body. Option D. Muscles do not need energy to work. The correct answer is option A. They provide movement of body parts. The correct answer is they provide movement of body parts. Question 139. How many bones are in the human body? Option A. 150. Option B. 300. Option C. 206. Option D. 250. The correct answer is option C. 206. The correct answer is 206. Question 140. What happens when atrophy occurs? Option A. The skin becomes thicker. Option B. The muscle wastes away. Option C. The bone becomes stronger. Option D. The muscle grows larger. The correct answer is option B. The muscle wastes away. The correct answer is the muscle wastes away. Question 141. Rheumatoid arthritis is an autoimmune illness. With an autoimmune illness, what does the body system attack? Option A. Viruses. Option B. Cancer cells. Option C. Normal tissue. Option D. Bacteria. The correct answer is option C. Normal tissue. The correct answer is normal tissue. Question 142. What is true of osteoarthritis? Option A. Pain and stiffness increase in cold or damp weather. Option B. It is a contagious disease. Option C. It is caused by lack of sleep. Option D. It only affects young children. The correct answer is option A. Pain and stiffness increase in cold or damp weather. The correct answer is pain and stiffness increase in cold or damp weather. Question 143. What is the basic unit of the nervous system? Option A. Organ. Option B. Neuron. Option C. System. Option D. Cell. The correct answer is option B. Neuron. The correct answer is neuron. Question 144. What is a function of the nervous system? Option A. It produces hormones for growth. Option B. It breaks down food for energy. Option C. It pumps blood through the body. Option D. It senses and interprets information from outside the body. The correct answer is option D. It senses and interprets information from outside the body. The correct answer is it senses and interprets information from outside the body. Question 145. What is true of assisting a client with one-sided weakness after a stroke? Option A. Stand on the stronger side. Option B. Stand on the weaker side. Option C. Make the client walk as fast as possible. Option D. Pull the client by the arm. The correct answer is option B. Stand on the weaker side. The correct answer is stand on the weaker side. Question 146. When assisting clients who have had a stroke, what should the HHA do? Option A. Feed the client as fast as possible. Option B. Place food in the unaffected side of the mouth. Option C. Place food in the affected side of the mouth. Option D. Only give the client liquids. The correct answer is option B. Place food in the unaffected side of the mouth. The correct answer is place food in the unaffected side of the mouth. Question 147. Where should the HHA stand when helping a client who is recovering from a stroke to walk? Option A. In front of the client. Option B. On the client's stronger side. Option C. Behind the client. Option D. On the client's weaker side. The correct answer is option D. On the client's weaker side. The correct answer is on the client's weaker side. Question 148. What does Parkinson's disease typically cause? Option A. Loss of hearing. Option B. Shuffling gait. Option C. High blood pressure. Option D. Extreme hunger. The correct answer is option B. Shuffling gait. The correct answer is shuffling gait. Question 149. Guidelines for caring for a client with multiple sclerosis include which of the following? Option A. Keeping the room very hot. Option B. Encouraging the client to run. Option C. Preventing falls. Option D. Restricting fluid intake. The correct answer is option C. Preventing falls. The correct answer is preventing falls. Question 150. What is true of spinal cord injuries? Option A. The higher the injury, the greater the loss of function. Option B. Injuries only affect the arms. Option C. Injuries always result in complete recovery. Option D. The lower the injury, the greater the loss of function. The correct answer is option A. The higher the injury, the greater the loss of function. The correct answer is the higher the injury, the greater the loss of function. Question 151. If a client has a hearing impairment, what should the HHA do? Option A. Speak into the client's ear. Option B. Turn off all the lights. Option C. Shout at the client. Option D. Face the client with the light on the HHA's face. The correct answer is option D. Face the client with the light on the HHA's face. The correct answer is face the client with the light on the HHA's face. Question 152. What is one way that an HHA can help a client who is visually impaired? Option A, speak in a very loud voice. Option B, use the face of an imaginary clock to explain the position of objects. Option C, move the furniture around frequently. Option D, leave doors half open. The correct answer is option B, use the face of an imaginary clock to explain the position of objects. The correct answer is use the face of an imaginary clock to explain the position of objects.